How do focal onset seizures differ from other types of epilepsy? Imagine your brain as a busy city with many neighborhoods. Seizures are like power outages that disrupt electrical activity. Some outages happen in just one neighborhood, while others affect the entire city at once. That's the key difference between focal onset seizures and other types of seizures. Epilepsy is a neurological condition where the brain has a tendency to have repeated, unprovoked seizures. These seizures happen because of abnormal electrical signals in the brain. Doctors classify seizures based on where they start and how they affect the body and awareness. The main categories are focal onset seizures and generalized onset seizures. There's also a third type called unknown onset seizures when the origin isn't clear. Focal onset seizures start in one specific part of the brain. Think of it like a power outage in one neighborhood rather than the whole city. These seizures are also called partial seizures. They can happen with or without awareness. When someone has a focal aware seizure, they stay conscious and aware, but might experience strange sensations, emotions, or movements. They might feel déjà vu, smell something unusual, or see flashing lights. These are called simple partial seizures. On the other hand, focal impaired awareness seizures involve a change or loss of consciousness. The person might stare blankly, seem confused, or perform automatic movements like lip smacking or hand rubbing. They often don't remember what happened afterward. Focal seizures can cause symptoms related to movement, like jerking or stiffening of a limb, or non-motor symptoms such as changes in sensation, emotion, or autonomic functions like a racing heart or stomach discomfort. Sometimes, a person might experience an aura, a warning sign like a strange smell or visual change, before the main seizure begins. This can serve as a warning to the individual that a seizure is about to happen. In contrast, generalized onset seizures involve both sides of the brain from the start. These seizures usually cause a loss of awareness or consciousness immediately. They often produce widespread movements, like stiffening or jerking of the entire body. Common types include absence seizures, which are brief lapses in awareness, and tonic-clonic seizures, formerly called grand mal seizures, which involve stiffening followed by jerking movements. Because they affect the whole brain, their symptoms tend to be more dramatic and widespread. Another important difference is that sometimes a focal seizure can spread to involve both sides of the brain, leading to a generalized tonic-clonic seizure. This is called a focal to bilateral tonic-clonic seizure. In this case, the person might experience an aura first, then lose consciousness and have convulsions. Correctly identifying the seizure type is crucial for treatment. Some medications work better for focal seizures, while others are more effective for generalized seizures. Doctors use detailed medical histories, descriptions of the seizure events, and tests like brain imaging and electroencephalograms to determine the type. This helps ensure the person gets the right treatment and understands the risks involved. Remember, epilepsy is a complex condition, and each person's experience can be different. If you or someone you know has seizures, it's important to see a healthcare professional for a proper diagnosis and personalized care. Understanding the differences between focal and other seizures helps in managing epilepsy effectively and safely.